Hi guys, my name is Tiffany and welcome back to another video. So for those out there who are considering about quitting nursing, please stop and watch this video first before you think about quitting.
'Cause anywhere with you feels right. Anywhere with you feels like Paris in the train. Paris in the train. When I'm with you, when I'm with you, Paris in the train. Paris in the train.
So I have been a nurse for 5 years now, and I know right now we are currently at a state of chaos and people are stressed out, burnt out at work. Hospitals are short-staffed, nurses are overworked, staff are overworked, we're tired. And I know there are other people out there who are considering wanting to quit nursing for other reasons as well, whether that's just being burnt out from work or just not finding the passion in wanting to work in nursing anymore. Whatever reason it may be, I want to really discuss this topic with you guys first and kind of help you guys find solutions before you really think about quitting. So I have been a nurse for 5 years now, and I know for some people that may be a short or long period of time, whatever you want to think about it. To me, it's still a very early beginning stage of my career. And I always felt like, yes, this is something I've always wanted to do and pursue, and that I can see myself doing this forever and ever and working in NICU and working in nursing for a very long time. But I'm going to be straight up honest with you guys. There are days where I really do consider other things in my life and other factors in my life that make me want to quit nursing. And right now, I don't have any personal things stopping me. Like, for example, I don't have a family to support, I don't have children and things like that. So it's not like one of those things that are pushing me back, as I know a lot of people quit their bedside jobs for that personal reason and wanting to be there for their families and things like that. But that's also something I do consider in the future. But currently right now, I feel like a lot of things has to do with being burnt out from work. And there are some people who probably don't feel that they're staffed adequately, or that they're getting patient loads that they can't handle, or just being at the current state that we're at with the world. A lot is going on and people are just tired, stressed, and burnt out and just don't have the ability or want to continue working anymore. And I totally understand all those things. And right now, we are currently at a state where there are people that are just reconsidering their life choices and their career choices, and nursing being one that's very impacted a lot right now. I know there are just people out there who are thinking about it. And so, yeah, it's a discussion that we all have been talking about with each other, I'm sure. And it's something that I even consider, as much as I really love my job and I love working with the patient population I deal with. There's just some times where we just get tired from work. So really what I want you to think first in your head and just answer some of these questions first is, are you just being stressed and burnt out from work? Or do you feel that your workplace isn't providing you the support that you need? These are some questions that you can ask yourself first, and these are some things that may easily be resolved. For example, yes, there are times where I feel burnt out from work, but what I've been doing is just having time away from work. When I'm off, I try to do things that I enjoy, one of them being creating content for you guys and filming videos. Other things involve spending time with people that I care about, and also doing activities for myself. Like, for example, I really love to read, and I love to do other activities that are just personal for me. Like, I like watching TV and watching TV shows and going to the gym and things like that. Like, I've been trying to do more self-care related things. And so it's very important for you to do a lot of self-care. And if you feel burnt out at work, please try to find things outside of work that you enjoy doing. For some people, the burnout just may be involved with being at work too much, and maybe you just need to cut down on some hours. Some people have gone part-time, per diem, or lessen the workload that they have at work, and that way they're able to have more flexibility and more work-life balance. So if that's just something that you need, then do what's best for you and yourself. And if you're just burnt out and you just need time away from work, maybe take your PTO, take leave of absence for a little bit, and take a little breather and do something for yourself. So those are some things that can probably be easily resolved. And if you feel like you're not getting the support you need at work, maybe you need to talk to your manager or your higher ups, your administration, and discuss ways that you can provide resources at your workplace. And I know that can be a little bit challenging for some places to be able to provide the resources for their staffing. And I know right now, with the state that we are currently in with the world, it's very hard to find the time and resources to do all those things when we're so busy trying to just do our patient task. But I'm hoping that your hospital has been doing their due diligence and providing resources for staffing during this critical time period. So it's probably a thing that needs to be more addressed and highly discussed at some of the workplaces that we're currently at, but it is a process that we're trying to work with. So hopefully staff is providing resources for each other and being support systems for each other. So I know a lot of times when we're currently busy with our patients and other staff needs help, if you can lend a helping hand to help ease other people out with their burnout, please do so. Another question that you may ask yourself is the workplace that you're currently at something that you're just tired of? And if it is, maybe you just need to switch to another unit. So I've been working in NICU for 5 years now, and for me, it's still something I still see myself doing for a while. And even if I do plan on quitting this unit, I still see myself working in a specialty that's still very similar to being in the NICU. Like, for example, maybe working in a high-risk infant clinic or doing something more outpatient where it's not as challenging as working at the bedside. And so that's something that you can consider for yourself. If maybe the unit that you're at is currently burning you out, and maybe you want to work in a unit that isn't as crazy, hectic, busy all the time. So consider that for yourself too, and other options you can take with nursing. There are unlimited options on things you can do. You don't have to do bedside care. You can also work in clinics, outpatients, like I said. You can even work from home. There are remote nursing options for you guys out there who want to do remote nursing. And there's even other opportunities as well for people out there who want to do something that is not as stressful. So look and consider all the options you have and think of ways you can really expand your nursing license. For some people, they can work from home and create side businesses with their nursing license. And there's so many nurses out there, especially on Instagram and social media, that have taken their nursing license to a whole new level. And for me, one of them being creating content for you guys and using my nursing license to educate other people, helping them out with their nursing journey is something that I've been doing. I've been doing a lot of teaching with NICU as well, and being more involved in my unit by doing teaching too. So that's something you can consider if you want to do something more creative. You can create side hustles at home and work from home and use your nursing license to do that too. So there are many options out there, so please consider those options before you think about quitting nursing. So going back to the other question that I asked earlier about having support at your workplace, also ask yourself this too. Are you feeling anxious and stressed out about going to work? Are the people that you currently work with, are they being supportive of your growth and learning journey? It's super important to find a place that provides you the resources and support that you need and also treats you with respect. And I know there are just places out there that have this toxic environment, and I've actually did a video on this on toxic workplaces, so make sure to check it out in one of the cards above. And basically in that video, I talk about how it's super important to find a workplace that supports you and makes you feel that you can have your voice heard at work. Currently at the workplace where I'm currently at, I feel like I can bring up suggestions to the team. People listen to my opinions and actually take into account what I have to say. And also the people that I work with that surround me as well are very supportive and helpful. And if I need any help during any critical situation or anything like that, there's always people out there to provide resources for me and go out of their way to help me. So I don't ever feel like I am being not heard at work, or that I'm being belittled at work, or that people don't respect me or listen to me. And if you are at a workplace where you feel all those things, then actually consider to yourself that maybe you're at a workplace that isn't right for you, and that it's not nursing that you're not wanting to do anymore. It's probably the workplace that you're currently at that isn't supportive of your growth and learning, and that you probably need to find a better workplace for you. So really, it sucks that this type of thing does exist, but it's your job in the end of the day, and it is your life. And if you're at a place that doesn't support you, then you need to get out and find something better. And I have been at places where I have the support that I need and people listen to me and help me. So I have not felt dreaded to go to work or not wanting to go to work because the people that I'm currently working with are not kind or not helpful, and I don't have respect and people don't listen to me or anything like that. I have not felt that. And if you are thinking the way that you do, please consider other places that may be supportive of you. And there are places out there that do exist, and that you just need to find it. And do not ever settle for workplace. In the end of the day, this is your life and your job. And if you ever feel dreaded to go to work or hate going to your job because of the people that you work with, then that is not the place for you. If any of these questions that you're asking yourself, and if you're reconsidering a lot of things that maybe resolve by just having a discussion with yourself, it's important to recognize that in yourself, and that maybe it's not nursing that you want to quit, but there are other factors that you may need to consider. And so hopefully you address those concerns in your head, and maybe this video helped you really question those things that you haven't really thought about. So hopefully this video is helpful for you guys, and just remember that you came a long way to get to where you are now, and you started nursing with a passion in your head, and that you wanted to do this for whatever reason you wanted to do. So please don't give up working in this career just because of other external factors that can be resolved. So hopefully this video is helpful for you guys, and I'll see you guys in my next one. Bye.